Are you wondering what happens if you get bitten by a rat? Well, you don't even have to get bitten, as they carry ticks and fleas that can spread Lyme disease. If you get bitten, it is important to seek medical attention right away. Rat saliva contains bacteria that can cause serious infections such as leptospirosis, hantavirus, or salmonella. It is important to act promptly, as in some cases you might even end up getting rabies. The most common signs of a rat bite include swelling, redness, pain, tenderness, and bruising around the area where the bite occurred. Additional symptoms like fever or nausea might follow due to the body's reaction to bacterial infections contracted through the bite. If any of these symptoms appear following a rat bite, it is best to seek medical attention right away to minimize the potential health risk associated with this type of incident. In extreme cases where large amounts of bacteria are present, or if there is an allergic reaction to components of rat saliva, then hospitalization and antibiotic treatment may be needed. Immediate diagnosis and treatment are essential for reducing complications that can arise from a rat bite. This can range from abscesses at the site of the wound to something more serious like sepsis caused by widespread infection throughout the body. So, is it possible to get rabies from a rat bite? Rabies is an infectious viral disease that can cause inflammation to the brain and death if left untreated. It is mainly transmitted through the saliva of infected animals, including rats. Although it is rare, there have been cases where people have contracted rabies after being bitten by a rabid rat. The general symptoms of rabies in humans include fever, headache, and muscle pain. But in more severe cases, neurological symptoms such as confusion, hallucinations, and paralysis may occur. So it is extremely important to take preventive measures if you encounter these rodents. If you receive a scratch or a bite, wash the wound thoroughly with soap and water for at least 15 minutes, and seek medical attention immediately. Vaccination against rabies can also help protect against infection, but it must be given soon after exposure to be effective. So now, what are the particular risks of getting scratched? It is important to keep in mind that rats are equipped with sharp claws and powerful teeth, so even the slightest scratch can be quite painful. It is important to take action right away to prevent further infection or harm. So, as you might have guessed already, washing the scratch site with mild soap and water is the first step to take. If the wound appears to be deep or jagged, medical attention should be sought out immediately. If it begins to show signs of infection, you must apply an antibiotic ointment or cream. In some cases, a tetanus shot may also need to be administered. This will depend on how recently the person has had their last tetanus booster shot. Lastly, if there were any signs of animal bites, such as saliva from the rat, then it is best to get tested for rabies or other disease that may exist in wild animals before seeking further medical treatment. By taking these precautions, you can help prevent much more serious health issues from occurring in the future. So it is best not to take any chances and always exercise caution when dealing with these pesky rodents. It is always a better idea to call animal control instead of trying to be the hero. And that's all for today's episode of Sound Health Solution. If you made it till the end, make sure to hit that like button and also consider subscribing to our channel if you haven't subscribed to us yet. Don't forget to ring the notification bell and tell us in the comments section, have you ever been bitten by any animal? Thanks for sticking around, and I will see you in the next video.